Have you ever noticed a strange smell when you go to the bathroom and thought, what on earth is going on? Smelly urine can be embarrassing, uncomfortable, and sometimes even a sign of something serious. But don't worry, today we're breaking down the 9 most common causes of smelly urine and how to fix it. Whether it's something you ate or a deeper health issue, we've got you covered. Let's dive in. Before we jump into the causes, let's talk about what normal urine should smell like. Ideally, your urine should have a mild odor or no odor at all. But when something's off, the smell can range from sweet to ammonia-like to downright foul. So what's causing it? Let's break it down point by point. Number 1, dehydration. When you're not drinking enough water, your urine becomes more concentrated, which can make it smell stronger and darker in color. The fix? Drink more water. Aim for at least 8 glasses a day. Pro tip: if your urine is dark yellow or has a strong ammonia smell, it's time to hydrate. Number 2, certain foods. Asparagus, garlic, onions, and even coffee can make your urine smell funky. These foods contain sulfur compounds that get excreted through your urine. The good news? The smell is temporary and harmless. Number 3, urinary tract infections, UTIs. If your urine smells foul and you're experiencing pain or burning during urination, you might have a UTI, urinary tract infections. Bacteria in the urinary tract can cause a strong, unpleasant odor. The fix? See a doctor for antibiotics. Number 4, diabetes. Sweet-smelling urine can be a sign of high blood sugar levels. When your body can't process sugar properly, it gets excreted in your urine. If you notice this symptom, get your blood sugar checked as soon as possible. Number 5, liver problems. If your urine smells musty or like ammonia, it could be a sign of liver issues. The liver helps filter toxins, and when it's not functioning properly, those toxins can affect your urine. See a doctor if you suspect liver problems. Number 6, medications and supplements. Certain medications like antibiotics and supplements like B vitamins can change the smell of your urine. If you've recently started a new medication, this could be the culprit. Number 7, kidney stones. These painful little stones can cause your urine to smell foul and appear cloudy or bloody. If you suspect kidney stones, seek medical attention immediately. Number 8, maple syrup urine disease. This rare genetic disorder causes urine to smell sweet, like maple syrup. It's usually diagnosed in infants, but if you notice this symptom, consult a doctor right away. Number 9, sexually transmitted infections, STIs. Some STIs like chlamydia or trichomoniasis can cause smelly urine. If you're sexually active and notice a change in odor, get tested. Now that you know the causes, let's talk about how to fix urine odor. Here are some quick tips. 1, stay hydrated. Drink plenty of water. 2, avoid foods that cause strong odors like asparagus and garlic. 3, practice good hygiene to prevent UTIs, urinary tract infections. 4, if you suspect a health issue, see a doctor immediately. 5, take medications and supplements as directed and talk to your doctor if you notice side effects. If you found this video helpful, give it a thumbs up and share it with someone who might need it. Don't forget to subscribe for more health tips and advice. And remember, your body is always talking to you. Listen to it. See you in the next video.